studies that I look at. One study has 1,000 people in it, and another one has 10 people in it, and another one has 15 people in it. The 1,000-person study showed that the drug was no benefit at all. But the two other studies that only had 10 and 15 people in it showed the drugs were incredibly superior. So what do they say? They say 2 out of 3 studies showed greater benefit to the drug group.
Perhaps the most common way of tilting the outcome of a clinical trial is simply not to count the individuals dropping out of the study because of the side effects. In fact, in clinical trials for the antipsychotic Zyprexa, 2/3 of the 2,500 participants had so many side effects they dropped out. Of the remaining 800, 22% reported serious adverse reactions to the drug. And during the Prozac approval trials, of the 11,000 patients tested, only 286, less than 3%, actually completed the short 4 to 6 week trials. In another common practice, adverse side effects are covered up by giving additional drugs that are not part of the study. And some researchers have been known to simply falsify the studies. Case in point, psychiatrist Farouk Abuzahab, former ethics committee chair of the Minnesota Psychiatry Society, whose patient he recruited into one of his clinical trials, reported having extreme thoughts of suicide. In his research documents, however, he noted 0 adverse events. 2 days later, she jumped from a Minneapolis bridge to her death. A final way of skewing test data is to hide unwanted drug reactions under less frightening terms. This trick was used in the notorious Paxil Study 329, where such side effects as aggressive events, homicidal thoughts, and homicidal acts were categorized under the word hostility, while under the nebulous term emotional lability were filed suicidal thoughts and actions. In many cases, clinical trials are set up not to look for violence and suicide at all.
It is a problem that if these clinical trials don't specifically really ask a lot of questions about the nature of suicidal ideation and how the person feels and hopelessness and akathisia, if they don't ask those questions very specifically, they're not going to really get that data, and it's not going to come up.
Designing biased trials to avoid negative findings, interpreting the raw data to favor your drug, and spinning the entire study to accentuate the positive are just some of the many, many ways to bias a trial. It is this perfect storm of intellectual dishonesty that has led one drug expert to conclude that it can be proven that most claimed research findings are false. But it is the drug companies that own the studies, and when they believe they have compiled enough evidence to convince regulators that their drug is safe and effective, they submit their phase 3 clinical trials for approval. The FDA only requires that 2 clinical trials be submitted, so drug companies can conduct as many studies as it takes to find the 2 that have the best chance at FDA approval.
You only need 2 positive trials against placebo, and it doesn't matter if you did 1,000 as long as you get 2. And it's amazing, sometimes they actually don't. They might pool data from another couple of clinical trials in order to get that approved.
They don't need to report all their data. They don't need to report all the trials that they do. They only need to report the ones that they want. They can handpick whichever one they want and then submit just those couple to the FDA.
As FDA Director of the Division of Neuropharmacological Drug Products, psychiatrist Paul Lieber complained, the sponsor could just do studies until the cows come home, until he gets 2 of them that are statistically significant by chance alone, walks them out, and says he had met the criteria.
The New England Journal published a study about a year ago showing that many clinical trials that had been conducted and registered with the Food and Drug Administration were never published because they came out showing no significant advantage over placebo. So antidepressants are not as effective as they are being made out to be, and the side effects are not as emphasized as much as they should be.
This point was driven home in 2008 by psychologist Irving Kirsch and his colleagues, who obtained every clinical trial ever submitted, published and unpublished, from the U.S. Food and Drug Administration of 4 new-generation antidepressants. The results were both alarming and enlightening. In Kirsch's words, antidepressant medications have reported only modest benefits over placebo treatment. And when unpublished trial data are included, the benefit falls below accepted criteria for clinical significance. In addition to this, volumes of effects associated with these antidepressants have since been discovered, including homicide, suicide, and mass murder.
People really don't realize that from the beginning there's been a question of how marginally efficacious these drugs really are apart from placebo.
And yet we have horrific side effects. Combine the two, and where's your risk to benefit ratio? It's down the toilet.
But psychiatrists dismissed Kirsch's study because psychotropic drugs are big business, and clinical trials are a big part of that business. Take, for example, Martin Keller, former chair of the psychiatry department at Brown University, lead author of the so-called Paxil 329 study. This clinical trial, which tested hundreds of children on the antidepressant Paxil, found that the drug was generally well tolerated and effective, which in scientific terms is glowing praise. And the study's list of co-authors, 22 of the most prominent key opinion leaders in psychiatry.
I mean, that was a lot of people, but they were the who's who of psychiatry, and this was going to be a publication that I think, took them, into the end zone on getting their approval for kids.
With the FDA's blessing, Paxil became a blockbuster in the child and adolescent market, with sales of $55 million in 2002. It wasn't until the New York State Attorney General's office sued in 2004 that the truth finally came out. The raw data showed that not only was Paxil no more effective than placebo, but the young patients on Paxil were 6 times more likely to have suicidal thoughts. In fact, this data also revealed that 11 of the 93 children on the study developed serious side effects, of whom 7 had to be hospitalized. But according to Keller's own administrator, many of those children were either dropped from the study or coded as non-compliant to avoid having to be counted. While admitting no guilt, the drug company settled out of court for $2.5 million, less money than Paxil was grossing every 7 hours. Hundreds of civil suits followed, but when Dr. Keller, as lead author of the Paxil 329 study, was deposed by attorneys, he would not admit to much.
I can't remember exactly what I said. I don't remember anything specific about any of these meetings. If my name wasn't on the top, I wouldn't remember ever having seen it. If I saw them, I don't remember. The answer is, I don't remember. I don't recall if I was. I don't recall asking him, which isn't to say that I didn't.
I want to pick up on the question Mr. Coffin asked you about the 5-fold increase of the Paxil kids experiencing suicidality over the placebo kids. Do you recall those questions?
I do.
And you said that you weren't particularly aware of that except for with regard to a manuscript that was sent to you in confidence by GSK?
Correct.
That actually is not correct, though. I mean, this was an issue that had been presented to you by a number of different reporters that you personally responded to. Is that correct?
I don't remember.
How could Dr. Keller have known so little about the drug study of which he was lead author, and which he himself used to promote Paxil for children in prominent medical journals and conferences?
The ultimate publication of Study 329 was ghostwritten by an agency hired by GlaxoSmithKline, and eventually they, after the manuscript was written, they put Martin Keller's name on it as an author.
There again, and maybe you can tell me where I can find it in the paper.
No, I'm asking you if you were aware.
I don't remember the specifics.
And then we finally showed him a document from GlaxoSmithKline where GlaxoSmithKline says that the study was entirely flawed. It was a complete failed study, and it certainly didn't show that Paxil was remarkably efficacious for treating children and adolescents in depression.